this classic episode around the indoctrination of our medical system, of the providers, following the protocol, and just women absolutely being dismissed and misdiagnosed and mistreated. Do not believe your own body. Believe me, the doctor, more than your own body. And I'm sure for a while she did. She like, maybe I'm crazy.
Yeah. And she just literally was felt lost.
Welcome to the Medical Disruptor, the only show where every guest must be clinically trained MD, NPs, PAs, and researchers who wanted more than the system gave them. And so they expanded beyond their conventional education to find real answers for complex health challenges. I'm Dr. E, the MP with a PhD, and I help smart, well-versed women go from medically gaslit to medically empowered. Our community is always informed, empowered, and science-backed. A place where well-versed women can ask the hard questions and get evidence-based answers you won't find anywhere else. Now, today's guest, you're going to love this guest. Her name is Dr. Peggy Margetson, a board-certified women's health nurse practitioner and CEO of Trust Women's Healthcare. She's a nationally recognized voice in women's health, named a 2025 Healthcare Hero, featured in Forbes Health, ABC's Here and Now, and Essence. She specializes in PCOS, menopause, sexual medicine, and preventive care, and she's built an amazing practice around equity and access for underserved communities. We're going to talk about how medical training has blind spots in women's health. Boy, don't you know it. There are so many blind spots in women's health. Maybe girl, don't you know it? Especially when it comes to the vaginal microbiome. That's a term you probably never heard of. That's why you're here today. And what you were taught to expect in the exam room might be completely outdated. So without further ado, let's dive in. Welcome, Dr. Petty.
Hi, Dr. E. How are you?
Oh, it's so glad to have you here.
So good to be here. Thank you so much for having me. I could talk about women's health all day long, so this is right up
I
your house.
I know, I can't wait. Before we get to vaginal microbiome, hello question mark, don't even know what that is yet. I want to first, let's hear about you a little bit first, right? Like, because everyone who comes here is a medical disruptor. So I want to hear a little bit about like how you first started. I imagine kind of like doing what everyone else did, maybe. I don't know, I'm assuming. And then when you had your aha moment, you're like, I'm gonna do it differently. Tell us your story.
So we all have had our training. We've had our education. We've had our training at different facilities, and we have the literature, the research, the guidelines, right? But we know that sometimes it just doesn't work. You're like, wait a minute, why is this not working for this population? Or they keep coming back with the same issue. So, in opening Trust Women's Healthcare, I wanted to demystify a lot of things that are going on. I wanted to get to the root cause. I was tired of hearing women come in with the same issue and we're giving the same uh, antibiotics, medications, and just not working. So I wanted to solve a problem. And I solved it by opening up Trust Women's Healthcare. And I'm solving one condition, one issue at a time, and really just listening to women and getting to the
What?
cause. Yes,
Listen,
listening.
I mean, just to circle here, because I also know you personally, honored to know you. You're solving for two issues, not just medically, but first you're solving, for anyone out listening who's local, is creating a space for marginalized women in Black and Brown community in the women's health world that really is lacking. I know it's not the main part of our talk, but I just had to surf for that for a moment because, like, all that.
Absolutely. Absolutely. And I'm glad you brought that up because, yes, we do know each other personally. And for your listeners out there, I always give you your props, your shout out, because you are the one who really put the bug in my ear because I came to you with, I want to do more. How can I do more? And you were like, open your practice. And being a Black woman, lack of representation, you were like, listen, you are needed in this community. You need to do it. So I am always forever grateful for putting that bug in my ear. And I think that it was one of the best decisions. And we are changing the landscape of women's health.
You are
We,
changing the landscape of women's health.
we
And
are.
then this other moment, because I can't wait to get to vaginal microbiome. Can't wait to get there.
Yes.
But how, before we get to the science behind it and this, like,
Mhm.
explaining to us what that is, there had to be like this, like, for me, it was like I practiced a certain way and there's a protocol and I did the and I thought I was doing everything right,
Mhm.
check, check, check. And then I was like, is this enough? Did you have a moment? Was there like a patient? Like, what was it that you're like, that give you the courage to step outside the box? What was it?
So the beauty of owning your own space is that you can kind of think outside the box and really solve an issue that your patients are coming in. It's not we are not blinded by, okay, we have to just hit a certain number and be able to, really pack in the schedule. I really had time. I built in time into the schedule to listen to women. So when I kept having the same women come back with the same issue, I was like, there has to be a better way. There has to. And I also thank the women that came to see me because they trusted me. They said, you know what, I'm going to trust that you know what you're doing and that you're really here to help us. So it took a lot of, and I don't know if it was really like an aha moment, but it was really like, I want to help these women. Like, I want them to feel better. Like, I don't want to keep adding to the problem. Like, it
Well,
wasn't like an aha moment. It really wasn't. I just wanted to help.
imaginal. I agree. It wasn't like a aha moment and then you suddenly this new thing. It a process. But what was the type of thing that was coming again and again where the standard protocol wasn't working?
So when women had come to me, they had already been to 4 or 5 different providers. They already had been given the CDC, the protocol antibiotics for recurrent vaginal infections, like your metronidazole, your clindamycin, your fluconazole. They were given all of that already. And what would happen is that they were just lost. They were at their wits' end and they were willing to literally try any and everything. So then they started doing things over the counter, listening to misinformation. The things that I heard, I was like, oh no, this is not what we're going to. So,
Well, I want to hear what you said, but I'm imagining I don't do GYN.
okay.
In the little that I know,
Hmm.
I feel like I want to make sure I understand because if I don't understand, I imagine orders insane. When you say people are coming again and again, they're coming in saying what, like I have discharge, I have, or what's the
Yeah,
recurring?
they're coming in saying that I have an odor or I have a discharge that this does not go away. I have people intercourse. Every time I get my cycle, I get the cottage cheese discharge, different colors. People are smelling my discharge, which is crazy, right? And so they're coming back with that, and it's just like something is wrong. So they would, of course, get the antibiotics. They would feel better, but then something else would disrupt that biome, and they're back to square one. So they're coming in with the typical complaints. Like it's not anything that is a unicorn that we haven't heard of, but it's just the typical symptoms, vaginal irritation that women just experience. And
I'm so sorry. Is this such an important topic because no one talks about vaginal odor?
no,
Like if you have it, you're not talking about it. You're embarrassed.
embarrassed. And the thing is that, let's be clear, like the vagina is going to have an odor. It really is, but the odor, yeah, it's the fishy odor, smelling like copper or ammonia, like that really strong scent. And odor is subjective. It can mean it could, what you smell may be different from what I smell. So it was really finding out what their baseline and what they were actually smelling. So it would take literally them coming in right when they have the symptoms, and let's try to find out what's going on. And I know it was crazy. And the things that putting them into the schedule, like if you think about it, these women were coming in like I was literally squeezing them in. What's
Um,
happening now? I need to see you, same day appointments. So we were accommodating our patients.
oh, I didn't consider that, right? Because you're like, I'll make an appointment in 2 months. Ma'am, it's not happening in 2 months.
Absolutely.
Oh, that's a big deal.
Hmm.
Okay, so I'm hearing that type of patient, right? Because a regular patient, maybe they have it once in a while. They
Hmm.
get their metronidazole, their flagyl, they get their little cream, never comes back again. We're not talking to you, sis. Amazing if you never had this. That's amazing. We're talking to one metronidazole, and then yeast infection, and then BV, and
Hmm.
then we'll go back and forth. And if I'm not mistaken, there's not much on this protocol. It's like this or this.
No, it isn't. And this protocol has been out for decades.
Oh,
For
okay.
decades. Like there is such a limited amount of research in this area because again, we would have to do observational studies or randomized trials. There are no animals that really have the vagina, right? That we can test certain
My
on.
God. It's amazing.
Yeah, there really isn't. So what we know is based on something from 30, 40 years ago, and now we're trying to do observational studies in terms of, let's see what works. This is what we know. Let's see what works. Let's try different things. Let's listen. Let's try to, restore like what their vaginal biome should look like. And then going through, and this takes time. And that's the thing with women's health, it takes time and you have to listen. Everyone is different.
Oh my God.
And yeah, I know.
But before, it never occurred to me how old these protocols are. Like, I know when I talk about hormones, I'm like, yeah, these people went to school in like 1975,
Yeah.
85, right? They're 60, 70 now, a lot of them. And so like it was like Flagyl or Diflucan. That's it. Have a nice day. This is crazy. Wait, so what are the type of things that people are desperate? People are desperate.
They're
So
very
what are the type of things they cry by the time it
So
comes?
they've tried the boric acid over the counter. They'll literally put in a boric acid at least once or twice a month, which again, it's killing everything. You don't want to kill everything in the vagina. You need that good bacteria. So they'll try that. What blew my mind was they were putting mouthwash in the vagina.
Oh, wow.
Mouthwash.
Wow. First of all, ouch.
I was like, mouthwash? I was like, no, 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 no. That's not what we're doing.
Yeah, I mean, people are desperate, like, and they're figure. Okay, so they've tried the protocol, they've tried the mouthwash,
Hmm.
they come to you,
Hmm.
and what a stellar idea, and you're like, "Okay, I hear you, I see you, call me, we will get you in on the day you have this." What do you do what's different? So what do you have that this protocol doesn't have?
Well, one is vaginal biome testing.
Okay, well,
That is
first of all, vaginal biome, what is that?
So, it's important to know, and this is taking it back. So, I need your listeners to really follow me, right? So, we have to understand how vaginal health works and vaginal biome. Just like the gut biome,
we have a vaginal biome that we need in order to protect from the ugly bacteria like bacteria vaginosis or yeast infection that tries to come in. So, our vaginas have estrogen. It's the hormone that helps keep the vagina healthy. We love estrogen. That's why in perimenopause and postmenopause, the pH goes up and women are having this irritation because they don't have it, right? So, just like the gut biome is good for digestion, is good for vaginal bacteria to help really kind of fight off a lot of the bad infections that would come up. It's like a safeguard. We want to be able to keep the pH at about 3.5 to 4.5. I'm taking it back to biology. We want to keep the four good lactobacilli bacteria in the vagina so that it can maintain and become healthy. So when you have things that can disrupt the biome, like sexual activity or antibiotics or soaps, or you're in the pool or you're at the beach or it's hot, the good bacteria is really like, no, 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 you're not coming in. I'm protecting this. So when women experience the recurrent vaginal infections like BV or yeast or sexually transmitted diseases, that protection is gone. So what they'll experience is recurrent BV because the medications that are out there, they don't restore the good bacteria. So that's what we got to get back to, is restoring the lactobacillus in the vagina.
This is mind-blowing. This is mind-blowing. This is mind-blowing, right? So this is like, oh my, because I talk about gut microbiome all the time,
Hmm.
and if the microbiome is a mess, then that's when you start reacting to everything. You're drinking water and you're bloated, right? There's
Yes.
nothing. There's no that people say like it's just no. I drink water and I'm bloated, and I'm like, okay, I got it. Your microbiome's a mess.
Yeah.
But this idea of a healthy vaginal flora
Hmm.
microbiome being the reason that we can sustain because it is externally facing, right?
Right.
It's out there. I mean, I know it's not out there. It shouldn't be out there, ladies,
It should
but
be
it's
out
out
there,
there.
but it's out there.
It's out there. Having sex, it's swimming, it's taking a bath. So it's out there, and what's keeping it safe this entire time is the microbiome, the vaginal microbiome.
Correct.
We completely took it for granted. I am blown away. And then we have two medications for you. One that will kill bacteria, one that will kill yeast. What? That doesn't solve the problem? Something must be wrong with you.
Exactly. And the thing is that when, and most people don't know this. Most, they don't know how to maintain their vaginal health, right? They're just thinking, okay, well, it has to deal with my hygiene. Maybe I'm not using the right soaps. Then they start using some soaps that have antimicrobacterial. They start using some things that are scented, some things that, and it's like, wait a minute. And your biome, your vaginal biome cannot handle all of this. It doesn't need
Wow.
it.
It's
It does.
even more fragrant than
It's messing it up even more. And then also there are different things such as antibiotics, foods, your periods, hormonal changes that's going on. So really identifying what it is. Now, don't get me wrong, there are certain things that are going on or you use that you introduce to the vagina that once you cut it out, you may restore the good bacteria. So, for example, we talk about antibiotics. You're not going to be on antibiotics forever. There's certain antibiotics like the Z pack. Everybody knows you take a Z pack, forget about it. You're getting a vaginal infection. Once you stop the antibiotics, you take a maybe a fluconazole, like your standard ones. It kind of restores the lactobacillus. But we're talking about the recurrent vaginal infections that create a thin film of that bacteria that it just cannot penetrate and get that lactobacillus back to where it needs to be. This is what we're talking about, that imbalance that your vagina has.
so. Okay, so what you're saying is that there's it's not perfect all the time,
No.
and you might have an assault, which is like antibiotics, and you can quickly fix that with,
Mhm.
and that's for some women. They're like, hey, when I and give me my diflucan because every time I take an antibiotic, I can get yeast infection or whatever. And for some women, it's fine. It's one and done. And so that's really good to know because we don't expect it to be perfect all the time. But we're going to, in a moment, talk about how you do this testing. But I'm just really curious. Um, does underwear make a difference? The type of underwear?
Oh, absolutely.
Tell us.
We all looked at the cute thongs that Victoria's Secrets, I'm dating myself now, Victoria's Secrets used to make, and you see the videos and all of that. The worst. The
The worst. Say more.
worse because again the vagina needs to breathe, though certain fabrics, polyester, spandex, they don't provide air for the vagina to breathe because then it creates that moisture that increases the pH. So that's why cotton lined underwear is good. Replacing your underwear, women, when you start getting the underwear where it's like the lining and it's like discoloration, get rid of it.
Th- This is really good concrete advice. No talking about that.
No one's talking about it.
Okay,
Get rid of
get
it.
those. They're not that expensive.
Not that expensive. I don't care if grandma gave it to you, 5 years ago. Get rid of it. It's no good.
Oh
Um,
my god, because that I'm imagining that that staining is a sign that there's something living, breathing there, and that's
Correct, the acidity. And the thing is that it is, again, the change of color is from the discharge. Remember, lactobacillus is a bacteria. It has a pH. So when it's constantly on the underwear, what it's doing is it's creating its own acidity. And then now you're washing it and it's changing its color and it's staying within that underwear. So it's touching the vagina, causing the disruption. So
oh
that's
no.
one thing. Also, the other thing is washing your underwear separately. Don't wash it with, someone else's socks. You know what I mean? Like it's not
What? This is mind blowing to me. Okay, that is I'm guilty of that. I just throw it all in one place. I have
no.
to wash it separately.
But listen, for some people that may
Oh,
be
you don't
too
even
much.
issue.
But if you're having an issue, it's every little bit counts. Every single
Oh, I
because
see.
again, this takes time. I literally sit down and we go through everything and making sure that we are tackling to try to find the root cause of what's
I
going
love this because it never occurred to me. Like if your man has crazy athlete's foot and his socks are in, I'm just imagining this right now, are in the pumping tree. Oh my god, this is definitely gonna be a short on Instagram. If your man has acne spurt, don't wash your underwear with his socks.
No,
Period. 30-second Instagram influencer because that never occurred to me. It's like it's not a sterile procedure. It's
no.
this
Wash
primordial soup that lives in your washing machine.
correct.
Right?
Absolutely.
That's crazy. What about food? Is it true yogurt? Tell us.
So yogurt has lactobacilli in it, so which is good. But foods that can disrupt is high in sugar. Like if you have that good weekend where you're out eating lots of carb, you're eating lots of sweets, or you're drinking like sweet alcoholic drinks, that can change your vaginal biome. Believe it or not.
Wow.
So we
Does it go back?
It all depends. It all depends. So
Then you can
again,
continue to party.
exactly. If it's a weekend, you'll notice like a shift, but this is where your good bacteria comes in. Your good bacteria has to be able to fight off if the pH starts to increase. But if you don't have any, or you get recurrent vaginal infections and you're eating like this, it's not helping the vaginal biome.
This is crazy. Okay. So the woman comes into you and she
Yeah.
says, I'm a hot mess. Nothing's helping.
Hmm.
What is it that you do? What is this test? Okay, here's a commercial break that's not really a commercial break because I'm not selling anything. I made you a free guide that will show you exactly how to track patterns, document symptoms, and get taken seriously. I called it Build a Case, the skills you already use everywhere else, but now you're going to use them here. Click the link in the description to get your copy. Now back to the show.
So what we do is obviously we take a history, we go through everything. Then there is a vaginal biome testing, which is like a swab. It's like a gynecological exam. Kind of take a look. I swab the skin around the labia, the vulva. I Because again, we want to make sure there are no skin infections that are causing this, right? So swab that, and then I swab by the cervix as well as the discharge, and then I send it to this lab. And this lab comes out with a printed report, and it tells us all of the pathogens that were tested and what was detected. But most importantly, it tells if there are all four lactobacillus bacteria, the good bacteria in the vagina, if it's missing, if your flora is healthy, and then also we'll give maybe some suggestions for the bacteria and pathogens that are detected. What antibiotic is not resistant to it? So, for example, when we started implementing this test, we found that many women had MRSA in the vagina.
Be quiet. Tell people who may not know what MRSA is what MRSA is.
MRSA is a methicillin-resistant Streptococcus aureus. It's like a bacteria that you see in the hospitals. You see from It's very bad. See from high use of antibiotics. Keep me honest. Like MRSA, you don't see it in your everyday
You
person.
don't see it. It's the thing that, you get this scary like Facebook post that, oh, MRSA flesh eating bacteria.
Yeah,
Not that.
it's
But
not.
that's what's associated with. It's bad. It's bad because it's a bacteria that is very hard to kill.
It is.
And to Dr. Paide's point, it's not something that we see often in the community. More we see in the sickest of the sick in the hospitals. So to see it in the community and in the vagina is mind blowing.
So, quick story. The first one I actually saw, because again, this is another thing that they don't teach us in schools. We don't learn in a lot of our training. So, when I first saw this, I was like, wait a minute, something must be wrong. So, I retested this patient.
I would
I was like,
retest too, but this
something
is
must be
doing it.
wrong. And then I actually called the medical director of the lab and I was like, well, what's going on here? Like, I've never seen this. But again, most optima tests, most lab testing for vaginal cultures don't test for this. So now we had the conversation and he said, yes. He was like, we're seeing this a lot. So that's why we're recommending it. So I treated this particular patient with mupricerin, which is a suppository for 14 days and was cleared it. And lo and behold, this patient felt better
Systemically or just in her vagina?
in her vagina because this
Wow.
is a suppository that goes right local to the vagina, and she felt better. Like she wasn't having the discharge, the
Oh my
odor,
God.
the irritation. But had I just did the regular Aptima screening vaginal culture, it would just come up as BV or yeast. Because again, BV is nothing but increasing the pH of the vagina. It's vaginitis. It's under this umbrella. So it's going to recognize that your pH is off and it's high. So it's going to detect, different bacteria. So it'll come back with bacterial vaginosis. You get your metronidazole, your clindamycin, fluconazole, and then you still have the same issue.
So with the BV testing, it's not like a full culture and sensitivity?
No,
Oh.
No.
They're just looking for the usual
The
suspects
usual
and the
suspects.
pH.
Yes. So most vaginal cultures will have maybe like 3 or 4 different type of bacteria that is associated with bacterial vaginosis. But what this vaginal biome testing does, it'll test maybe 7 or 8 that's just associated with BV. Then it'll test maybe like another 8 or 9 that's associated with candida, which is what your yeast infection usually is. That's the culprit. And then it'll test for a plethora of different pathogens.
This is this is huge. For those listening, you need to understand because you're going to your GYN, you're putting your legs in those horrible stirrups. Sorry, Dr. Peggy.
Mhm.
You're doing this horrible exam. Sorry, Dr. Peggy.
That's okay.
And
It's all true. It's all true.
and they're swabbing you, and you're thinking, oh, they're swabbing me. They're gonna know what's good. And I, for the first time ever, it's kind of like when you go. One of the things we do differently is like when you go to get a strep test, they test you just for strep. And it's a yes or a no. So you're saying with BV, they have like 4 or 5 things, and there's like yes or no. You have it, great. But what we do in our practice, we don't just test for strep, though. We do a full culture. We want to see what's growing because you could have a lot of things besides strep. So the test you're doing is like, hello, hi, why are we stopping at 4 or 7? You do the culprits for the BV, culprits for yeast, and what else is happening? You would have never found this woman's MRSA,
No, never.
which is insane.
It's like I've never seen this in any of my training. I've talked to colleagues who haven't seen it, and it was like, okay, let's treat this. And again, the initial shock of the patients, like they start to go into Google and they're like, "What is this? My
I'm
vagina."
gonna die.
Exactly.
Yes.
But you're not going to die. It's not a sexually transmitted infection. Again, I can't explain how they contracted this bacteria. I don't
I
know.
I could see I was just thinking, how could this happen?
Hmm.
Imagine I'm a nurse. I'm taking care of a few patients. And, I wash my hands, but I didn't do like the whole, happy birthday washing hands. You have to sing the whole happy birthday.
Happy
I
birthday.
went to the bathroom real quick between patients. I wipe. I shouldn't say I because someone's going to listen to this. And again, making sure the person wipes.
Right? Exactly.
The person wipes. And and lo and behold, MRSA is there. Like I could or taking care of the grandfather or working in old age home, I could see a really easy use case how it can get there.
Okay. Yeah.
Or the partner
Hmm.
is a patient transport
That is
and did something like that. So like it's not a far fetch, especially if you're saying you've seen it quite often, like
I'm
more
seeing
than just
it
that one time.
It's not just one time. It's not just one time. And we're seeing it enough to say, okay, there's something going on. So, like I said, patients are coming in. We are doing these vaginal biome testing, and most insurance cover this. So I know that there's a lot of vaginal biome testing out there. I'm not knocking anyone's hustle, but one of the reasons why, just keeping with the show Medical Disruptor is because I am creating an access, a space for people in marginalized communities that things may be cost prohibitive that are still dealing with these issues. So, having bill insurance for vaginal biome testing to really get to the root cause is just a game changer for us. And really to help all of these patients and women coming in is just, it feeds our soul, to be honest.
It's so simple. Like I just want to cry in its simplicity.
Mhm.
It's so simple. That's Peggy. Why isn't everyone doing this? Why are old school how did I say old school? There's plenty of new school docs
Yeah.
and PAs. Why are they staying stuck? Why do they have this blind spot? Tell me why.
Because I think it's the common theme with women's health, right? No one really cares about women's health. And so it would take someone to really have the passion to care and to really delve further than your norm. And then women often get their symptoms dismissed or ignored. So if you, like for example, I had a patient come to me that is having recurrent BV, recurrent vaginal infections, and she was told by a previous provider, oh, because she's not sexually active, that there's no way that this can happen. And that, yes, yes. And yes. So it takes someone really listening and having the time. And our healthcare system sucks. It really, really does. Especially if you're an insurance based, and Dr. E, you know this, insurance based practice, it is based on the numbers and seeing as many patients as you can. So, So it really takes someone like myself and the other providers that I have here in the office to really carve out time in the schedule to listen, to have them come back, follow up, not follow up 6 months from now. Let's follow up in 2 months. Let's follow up in 3 months. Let's see what's going on. Let's follow you and to see how this is working. So
I'm
we're
so glad about I'm so glad about this case study because I would have asked you, give me an example of a patient that was gaslit. So this is one ultimate form of gaslighting.
hmm
And I'm sure the provider who said this to her was well-meaning and thought that they were correct.
yes.
Not sure how, but they
Uh-huh.
felt they were correct. Imagine that woman's experience of being told basically, you're not having symptoms. Not I can't figure it out. You're not having symptoms. Do not believe your own body. Believe me, the
Mhm.
doctor, more than your own body. And I'm sure for a while she did. She like, maybe I'm crazy.
Yeah. And she just literally she felt lost. That's exactly what she did. And for your audience, vaginal infections can be sexually associated, but it's not the primary cause. That's how old school thought of thinking, like BV is from sex. No, there's other causes
Which
of, we just listed them.
what is that? Just swimming, bathtub,
The summer.
fawn, your food. I wrote them down.
Yes,
Antibiotics.
exactly. Yeah. And insane. So, one of the things that we always do is we validate people, our patient's symptoms. We validate and we say, listen, we don't know everything, but here's what we know, and we're going to try to find out. And this is where this vaginal biome testing came in, because it came in from just wanting to help women like with this issue. This can be debilitating, like if imagine walking around and your vagina is irritated all the time.
Absolutely not. There's no man in the world
Oh,
would walk around with their testicles agitated all the time.
yeah.
They just wouldn't go to work.
They wouldn't go to work. And so we said, no, we're going to figure this out. And we have, and we're doing it. We've done the vaginal biome testing. We get the results, let alone we call all our patients with all of their results. We specifically call we discuss the vaginal biome testing results. We go through what we detected, and then we go for treatment plans, right? So we're not using the traditional treatment plans. When I say traditional, the ones that we talked about, the
Mhm.
antibiotics, because we know they're not working.
Oh,
They're
yeah, what are the treatment plans?
Yeah, they're not restoring it. So the goal is to restore the lactobacillus in the vagina, and that comes from vaginal probiotics. And what we're also doing is adding dextrose, because you want to give the bacteria the energy to grow and restore balance. So this is from a compounding pharmacy where they're literally compounding probiotics dextrose, putting it in a suppository form, and it's a 30-day treatment. Unfortunately, it is out of pocket. Insurance will not cover this. But after 30 days, women tend to feel better. We also do like your test of cure, so to say, where we reswab and we're finding good, good information and data where it's restoring the lactobacillus and the healthy flora in the vagina.
Wow. So you're doing I mean, the ultimate scientific study, you're doing pre and post testing
hmm
to make sure that what you have I mean, you couldn't ask more, and it drives her crazy because this would still be considered anecdotal, and it's not.
It's not.
It's not. That is wild.
Yes.
So and then your treatments are so you have this probiotics, obviously what you discussed is like, "Hey, wash your underwear separately.
hmm
Hey, change your diet. Don't take antibiotics for every sniffle," for
Yes.
many reasons.
hmm
Um, what should women do if they're experiencing this and their doctor's like, would you listen to this podcast, Medical Disruptor? What is this not that?
Tell
What do they
I want them to come see me. And then also the other thing that we're doing, and which we kind of knew for when I say we in the women's health community, just like sexually transmitted diseases, you treat the patient, the partner needs to be treated. The study that recently came out with treating male partners, we also have implemented that where we're allowing patients' partners to come in as a patient. We're doing a consultation and we're treating them with antibiotics such as metronidazole, which is by mouth that they're taking, and then clindamycin, which is a cream that's going over the penile skin for about 7 days. And that also has shown some good reduction in recurrent vaginal infections.
I'm wondering, and I don't know if you have this patient population, if that is also true for same-sex relationships.
So that is a very good question. We have not done any studies in terms of, because again, with same sex, we have not done it because I'm seeing women. You're talking about women. Well, if it's two women, I'm really treating both of them, right?
Well, because they're both your patients, but I'm saying one
Exactly.
direction, would you say, "Hey, I think you should bring your partner in?"
Yes, absolutely. I let them know, bring their partner in. We talk about maybe also with the same sex community in terms of sharing toys. That's another thing that can harbor, infection and cause a disruption as well. So we are, like I said, we
That's a really, really good point. Cleaning toys, sharing toys, that's a really good point.
and that's
Huh.
part of the education that we go through where again you have to have the time to sit and really go through their habits, their lifestyle, and be able to really kind of find, it's almost like CSI. Really is, it's CSI. And then I can't forget my menopausal patients that come in with the recurrent vaginal infections, and all they need is estrogen. That's all they
All
need.
we need is estrogen.
All they need is estrogen.
I love it. All you need is estrogen.
Yes.
No one knew I could sing too.
Yes.
That's amazing. Okay, let me recap this, 'cause this is phenomenal. This is one of my favorite episodes, I
Oh,
already know.
thank you.
So phenomenal. So phenomenal, and it's yeah. So, like, I just wanna recap. First of all, everything that we're doing around not you, but generally speaking in the GYN world around vaginal infections are based on an old protocol that has not been renewed. And this is true also for hormones, we know this. This idea of a vaginal microbiome is absolutely mind-blowing, yet so obvious once you said it. We know there's a lung microbiome, a bladder microbiome, a skin microbiome, but, well, how did I skip the vagina? So, thank you for
And
sir.
think about how many studies are on the gut biome. Every time you turn around, someone's talking about the gut biome. What about the vagina is just as equally important.
Oh my god, yes. Oh my god, yes. And then the idea that the testing that's out there, not just the protocol, but testing doesn't test everything in the microbiome. So a woman can really be like, I'm proactive, I'm showing up, I'm getting the swabs, and they're telling her everything's fine. So now the data is
Mhm.
telling her she's crazy, but it's the wrong test. That is a big deal. And then the goal of treatment, which is not to get rid of the odor. It's not to get rid. The goal of treatment is to restore microbiome and reintroduce the lactobacillus. That's a completely different goal of treatment.
Yeah.
And that treatment is not just pharmaceutical. It's so much lifestyle involved.
Mhm.
No more thongs, ladies. So sorry if you have this issue.
Yes.
I mean, that's insane. And the idea of treating your partner, even though it's on STD,
Yes.
is absolutely mind blowing.
And
This is great.
I have to shout out to my patients partners that have come in to a all woman practice and really taking one for the team and coming in and getting the consultation and also getting treatment. So I have to shout them out because it could be a little intimidating.
Yeah, no, that's big. I'm glad that you did that. And so you create a space, like it is scary, it's uncomfortable, but good for you. I love that.
Yes.
Men loving women like that. That's amazing. That is great. Okay. And then obviously if you're in New York, you are only going to see Dr. Peggy from now on. So tell us where they find you.
So we have two locations. It's Trust Women's Healthcare, all spelled out. And we're in Brooklyn and Bed-Stuy. And we're also in Deer Park. We're in Long Island.
Yep.
So we have myself and four other amazing clinicians that are all here, ready, willing, able to listen to you and to do this vaginal biome testing. We do accept most insurances, including Medicaid. I always specify that because not everyone accepts Medicaid. And yes, you can have a consultation with Medicaid for vaginal biome testing. And I'm on all social media platforms, and we
Yes, you are.
are ready to care for you.
Oh my goodness. This has been amazing. This a classic episode around the indoctrination of our medical system, of the providers. Again, without malice, there's no doctor bashing here, but just following the protocol and just women absolutely being dismissed and misdiagnosed and mistreated as a result of this blind spot. And it's just fascinating. Dr. Peggy, thank you so much for being here. That's another episode of the Medical Disruptor in the books. And that was Dr. Peggy showing us exactly how indoctrination and medical training leaves massive blind spots in women's health and how disrupting the standard playbook can actually change outcomes. If your provider is still stuck in the old infection only model, now you know what to ask for, what to question, and how to advocate. This is what medical disruption looks like. It's not blaming, but exposing the limits of the training and pushing the conversation forward. You're now in a community that doesn't exist anywhere else, a safe space for women who want real scientific information, not nonsense, but also want to ask questions without being made to feel crazy. Our community is informed, empowered, and science backed. If you want more information on anything at all, my website is drafratlamandra.com, and it has my book, PDFs, newsletters, a link for consults, everything. Until then, keep asking questions, keep asking for more, and keep disrupting.